Hello dear friends, welcome all of you to the prestigious LMS of APCCA, Government of AP, Commissionerate of Collegiate Education. I am Durga Berry, working as Assistant Professor in Biochemistry. Now we will discuss the plasma proteins which are involved in health and disease. Before we go in detail into the topic, let's learn some of the fundamental definitions. The blood is fluid connective tissue which is composed of plasma and plus formed elements. These formed elements are RBC, WBC and platelets. And we have also seen the definition of plasma that it is a clear straw fluid which contains some proteins, mainly albumin, globulin and fibrinogen. And coming to serum, which is nothing but the plasma minus clotting factors. From the plasma, if we remove this clotting factor, it becomes the serum. That means what the serum contains? It contains albumin as well as globulin. And we also have seen that the plasma contains 92% of water and the plasma proteins are 8%. These plasma proteins majorly they contain proteins like albumin, globulin and fibrinogen. Hence today we are going to deal with the plasma proteins. How are they behaving during the health conditions and disease, particularly the increase or decrease of these proteins. The normal values of these proteins, the plasma proteins, are the total protein content in plasma is 6 to 8 grams per deciliter or else 6 to 8 grams per 100 ml of the plasma. And among that, albumin contains 3.5 to 5 grams per deciliter. Globulins account for 2.5 to 3.5 grams per deciliter. Fibrinogen accounts for 200 to 400 milligrams per deciliter. All these are the normal values in an healthy individual. And the important aspect is albumin to globulin ratio, which is called AGR. This is the ratio between the plasma level of albumin and globulin, usually called Albuminglobulin ratio, which is 1.2 to 1.5 is to 1. That means this one part is globulin ratio. For every one part of globulin ratio, there will be 1.2 to 1.5 albumin is present. Coming to the origin of plasma proteins, in the embryo, these plasma proteins are synthesized by the mesenchymal cells, and albumin is the first plasma protein that was formed. In the adults, the plasma proteins are synthesized from the reticuloendothelial cells of the liver, and these plasma proteins are also synthesized from spleen, bone marrow, disintegrating blood cells as well as from general tissue cells. Gamma globulin is synthesized from B lymphocytes. Plasma proteins are mainly synthesized from liver as well as they are also synthesized in small quantities from spleen, bone marrow and other tissues. But gamma globulin is synthesized from the B lymphocytes. Gamma globulin mainly accounts for what? Antibodies. Let's see the proteins, plasma proteins, one by one. First one is albumin. Albumin is the major constituent in plasma proteins, and we have seen that it is formed from the liver, whose molecular weight is 66,000 Daltons, and the normal value is 3.5 to 5 grams per deciliter in healthy individual. And the polypeptide chain has about 585 amino acids. You know that it is the protein. The protein is made of the amino acids. And how many amino acids are present in albumin? 585 amino acids are present. The half-life of this protein is about 20 days, and it is not a glycoprotein. Glycoprotein is what? Whenever the carbohydrate residues are also present in the protein, it is called as glycoprotein, but it is not a glycoprotein, and it is a small molecular protein which has maximum mobility. These are the few important aspects of the albumin. Let's move to the functions of albumin. It performs mainly 4 major functions. What are they? The first one is maintenance of colloidal osmotic pressure. It is involved in transport transport of some molecules. Let's see what are they. And it shows the buffering action, or it has a buffering capacity, plays a nutritive role also. The first function is colloidal osmotic pressure of plasma. It maintains proper pressure in the plasma, and the pressure which is caused by the plasma proteins is called oncotic pressure. Remember, the pressure which is caused by the plasma proteins is nothing but oncotic pressure. This albumin is majorly produced from the liver, and it is produced in high amounts. That means 12 grams of albumin per day are produced. The osmotic pressure exerted by the electrolytes inside and outside, they cancel each other. Remember, the osmotic pressure exerted by the electrolytes like sodium, chloride, etc., they cancel each other in and outside. But the proteins, they cannot escape out of the blood vessels. So these proteins, they exert osmotic pressure. Significant osmotic pressure is exerted by the proteins, and this pressure is about 25 millimeter of mercury, and it is contributed by the all plasma proteins. But remember, 80% of this osmotic pressure or oncotic pressure is contributed alone by the albumin. That means albumin is very important in maintaining proper osmotic pressure in the plasma. See, this is the blood vessel, the wall of the blood vessel, and these are the albumin molecules which are inside, and these albumin molecules, they are restricted in the blood vessel. They cannot move out of the blood vessel. There is a restriction for the moment. Due to that, it exerts the osmotic pressure, which can draw the water into the capillary, but the protein, it cannot come out. The maintenance of blood volume is mainly dependent on the oncotic pressure. That means oncotic pressure. Oncotic pressure is what? The pressure exerted by the plasma proteins is nothing but oncotic pressure. Because of the oncotic pressure, there is sufficient volume. That means the maintenance of blood volume is dependent on the osmotic pressure. That means oncotic pressure. If the albumin levels fall less than 2 grams per deciliter, what happens is it drives the fluid out of the vascular component. That means from the blood vessels, it loses water, which leads to the accumulation of fluid in the interstitial spaces or tissues, which causes edema. This is the first function. What is the first function? Maintenance of the osmotic pressure. Then second function of the albumin is buffering action or buffering capacity. As albumin is the protein contains amino acids. Mainly this albumin contains around 16 histidine amino acids. We know that the albumin protein contains how many amino acids? It contains about 585 amino acids are present. Is it not? Among the 585 amino acids, there are 16 histidine amino acids which are useful in maintaining the buffer capacity because they have the ability to accept or donate the protons. As the albumin is much in quantity, it shows maximum buffering capacity. This maximum buffering capacity is because it is made of protein, amino acids, and particularly the buffering action is because of the histidine amino acids. The third function of the albumin is transport. It is involved in transport of various hydrophobic substances in the blood. As albumin is present in the blood, it carries different molecules. Which molecules are carried by the albumin? The first one is unconjugated bilirubin is carried, and free fatty acids are carried in the plasma. Drugs like aspirin, salicylate, and sulfaphenytoin, these are the different drugs which are carried by the albumin, and steroid hormones, thyroxine, they are carried by the albumin. Copper, calcium are also carried by the albumin. Vitamin A also requires albumin for its transport. Then the fourth one is nutritive function. The albumin is made of amino acids. We have seen that 585 amino acids are there, and it is said to be one of the nutritionally complete protein. What is a complete protein? The protein which contains all the essential amino acids. There are total how many amino acids are present? 20 amino acids are present in total, which are divided into essential and non-essential amino acids. Essential amino acids are those which are not synthesized in our body. That is why they have to be taken through diet. And when we take the amino acids through diet, it synthesizes some important proteins like albumin, and albumin is the protein which contains all the essential amino acids. As it contains all the essential amino acids, albumin is taken up almost by all the tissue cells. All the tissue cells can take up albumin by a process called pinocytosis. And the pinocytosis is nothing but a type of endocytosis. When the cell accepts or tissue accepts albumin, this albumin is broken down into individual amino acids, and as they contain all the amino acids, all the essential amino acids, these essential amino acids are involved in the synthesis of different proteins. That is why albumin is a complete protein and it plays the nutritive role. A complete protein or whole protein is a food source which contains all the adequate portion of each of the 9 essential amino acids required in the human diet. After completing the different functions of albumin, let's see the clinical aspects. The hypoalbuminemia, that means the decrease in the concentration of albumin, leads to some diseases like kwashiorkor. Decreased intake, if the kids do not take proper protein food, which leads to the kwashiorkor, which is nothing but protein malnutrition. And in the body, whenever there is decreased synthesis, it leads to the liver cirrhosis. Whenever the albumin is lost, the increased loss of albumin occurs through gastrointestinal tract, which is because of intestinal inflammation, and if it is lost through renal route, it causes nephrotic syndrome, acute glomerular nephritis. If it is lost through skin, it causes skin burns. These are the different reasons for hypoalbuminemia. And albuminuria is presence of albumin in urine. If it is lost in urine, it is called albuminuria. Microalbuminuria, it is the range is 30 to 300 milligrams per deciliter of albumin. If it is lost, it is called microalbuminuria. And the low level of albumin also leads to hypothyroidism. Decreased level of albumin also leads to excessive intake of water. Those are all the features of hypoalbuminemia. And whenever there is increased concentration of albumin, the condition is called hyperalbuminemia. Hyperalbuminemia leads to dehydration, excess of glucocorticoids, and congestive heart failure. These are the result of hyperalbuminemia. The second important plasma protein is globulin. Just let us remember once again that the major plasma proteins are albumin, globulin, and fibrinogen. This is the second important protein. Globulin is second important protein of plasma, which is also synthesized by liver. All the plasma proteins are synthesized in the liver and also by the cells of reticuloendothelial system and plasma cells. These globulins, they fall into three categories. They are alpha globulins, beta globulins, and gamma globulins. Among the alpha globulins, they can also be divided into alpha 1 globulin, alpha 2 globulin, and beta globulins. Likewise, there are also two types, beta 1 globulin and beta-2 globulin. The molecular weight ranges from 90,000 Daltons to 156,000 Dalton. The globulins can also function as transport proteins like transferrin, ceruloplasmin, hemopexin, etc. And they also form different proteins, lipoproteins, in combinations with lipid and plasma. That means the globulins can function as lipoproteins. They are also like transferrin, ceruloplasmin, hemopexin. The antibodies are also known as immunoglobulins. They are also gamma globulins which are formed by the plasma cells. The normal albumin globulin ratio, which I explained earlier, is 1.5 to 2.5 is to 1. In many cases, albumin globulin ratio is altered, and this detection of albumin globulin ratio helps us in diagnosing some diseases. These globulins, they can be separated by electrophoretic method, which I will explain later. The globulins or else the plasma proteins can be separated by electrophoresis. Let's see the clinical aspects of globulins. Hypoglobulinemia is nothing but the decreased level of globulins, and hyperglobulinemia is nothing but increased globulins. Hypoglobulinemia, that means decreased level of globulins, leads to liver cirrhosis, chronic infections, nephrosis, rheumatoid arthritis. And hyperglobulinemia, that means increased level of globulin protein, leads to emphysema, acute hemolytic anemia, glomerulonephritis, hypogammaglobulinemia. These are due to the hyperglobulinemia, increased level of globulins. And the third important plasma protein is fibrinogen. The molecular weight is about 340,000 Daltons, a large protein which is also produced by the liver, and it plays important role in blood coagulation. Blood must be coagulated when it comes in contact with the air, and for the blood coagulation this fibrinogen is important. Fibrinogen is broken down into fibrin, and this fibrin, it along with the RBC, it forms clot. This fibrinogen contributes to the viscosity of the plasma and determination of the ESR, erythrocyte sedimentation rate. The levels of fibrinogen are also important. If decreased level of fibrinogen is there, it is called hypofibrinogenemia, and increased level of fibrinogen, the condition is called hyperfibrinogenemia. Hypofibrinogenemia leads to liver dysfunction, and anabolic steroids, use of phenobarbital also leads to hypofibrinogenemia. Hyperfibrinogenemia is nothing but increased level of fibrinogen, which is during the acute infections, and it is also found during the rheumatoid arthritis and glomerular nephritis, myocardial infarction, stroke, and trauma. These are the results of increased level of fibrinogen in the plasma. Let's see albumin globulin ratio, AGR, which is 1.2 to 1.5 is to 1. Whenever the albumin globulin ratio is low, it leads to liver dysfunction and nephrosis. When AGR level increases, albumin globulin ratio increases, it leads to hypothyroidism, excess of glucocorticoids, hypoglobulinemia. That means globulin levels decreases, and there is intake of high carbohydrate or protein diet. Then let's see small important topic called acute phase protein. What are these acute phase proteins? These are nothing but group of plasma proteins which increase or decrease in response to the inflammatory or some neoplastic conditions. They are called acute phase reactants or acute phase proteins. There are two types of acute phase proteins: positive acute phase reactants and negative acute phase proteins. The positive acute phase proteins are those whose concentration increases in response to inflammation or neoplastic condition. That means whenever there is inflammation or neoplastic condition, if the plasma proteins increase, then it is called positive acute phase proteins. These proteins which increase are C-reactive protein CRP, ceruloplasmin, haptoglobulin fibrinogen, alpha-1 acid glycoprotein, and alpha-1 antiprotease. All these they are called positive acute phase proteins because they increase during the abnormal conditions. Whenever there is decrease in the plasma proteins during inflammatory and neoplastic conditions, these proteins are called negative acute phase proteins. These negative acute phase proteins include albumin, then transthyretin or prealbumin, retinol binding protein, transferrin. What happens to these proteins? They decrease. When do they decrease? During inflammation and neoplastic conditions. That means during abnormal conditions, they decrease in concentration. That is why they are called as negative acute phase proteins. There are positive acute phase proteins like C-reactive protein, ceruloplasmin, fibrinogen. They increase in concentration, and there are also negative acute phase proteins. They decrease during abnormal conditions like albumin. If the albumin level decrease or if the C-reactive protein level increase, then we can understand that there is inflammation or neoplastic condition. Let's see the transport proteins and the compound it binds. Albumin, it binds to bilirubin, free fatty acids. It carries calcium and metals like copper, zinc, also some gases, methane, steroids, and hormones, all are bound to the albumin. Then ceruloplasmin binds to copper. Likewise, corticosteroid binding globulin, it binds to cortisol. Haptoglobulin binds to extracorpuscular hemoglobin. That means it binds to the hemoglobin which is not present in the RBC. Then lipoproteins, they are the plasma lipids which are binding to the lipoproteins. And hemopexin binds to heme. Retinol binding protein binds to retinol. That means it carries retinol. And testosterone and estradiol are carried by sex hormone binding globulin. Thyroid binding globulin, it binds to T4 and T3. T4 and T3 are carried by thyroid binding globulin. Transferrin, it carries iron, or else iron is carried by the protein transferrin, which is transport protein. And transthyretin or prealbumin, what it does? It binds to thyroxine and retinol. These are the transport proteins and the molecule it binds. Let's see the functions of plasma proteins. Albumin maintains colloidal osmotic pressure of plasma. It is nutritive in function and it has a buffering capacity, and it also function as antiprotease for antitrypsin or alpha-1 antiproteinase, macroglobulin, antithrombin. All of them, they behave like antiproteases, and some of the plasma proteins are involved in the blood clotting like fibrinogen and various blood clotting factors. These are also the plasma proteins which are involved in blood clotting. Erythropoietin acts as hormone, and the immunoglobulin, complement proteins, and microglobulin, they have defense mechanism. They are involved in the defense, protecting our body. Then acute phase reactive proteins like C-reactive protein, acid glycoprotein, they function as inflammatory responses. That means inflammatory markers. We can also say that they act as markers. And fetoprotein, it functions like oncofetal. These are different functions of plasma proteins and the names of plasma proteins. Let's see one of the basic aspects. Again, the plasma proteins are usually three types, and they are identified by the salting out of plasma proteins. They are fibrinogen, albumin, and globulin. They are also separated with the help of electrophoretic technique. The serum proteins can be divided into 5 bands from anode to cathode. Anode is a positive electrode, cathode is a negative electrode. From anode to cathode, the separated proteins are albumin, alpha 1 globulin, alpha 2 globulin, beta globulin, and gamma globulin. Let's see, this is the electrophoretic mobility. Albumin occupying the major portion around 55%, then alpha 1, this is alpha 2, beta 1, beta 2, and gamma globulin fractions, which are separated by electrophoresis. This is the specific pattern which is seen in case of the normal individual. Albumin concentration is very, very high. Then beta 1 concentration is somewhat higher in the normal individual. But abnormal electrophoretic patterns can be seen in the plasma protein during some disease conditions. This is the normal condition, and what happens during chronic infection, the gamma globulin fraction is increased, a smooth wide band. This is the gamma globulin portion which increases during the chronic infection. And during multiple myeloma, sharp band in the gamma globulin region called M band is due to the monoclonal raise. That means during the chronic infections it is the wide band, but during the multiple myeloma there is a sharp band which is appearing like this in the gamma globulin fraction. Then it can be diagnosed as multiple myeloma. During another disease, nephrotic syndrome, the alpha 2 fraction is the most prominent, as all other small proteins are lost through the urine. This alpha 2 fraction, it can be observed during the nephrotic syndrome, and during cirrhosis the albumin band is thin. This is the thick albumin major portion, but during the liver cirrhosis the band becomes very thin. The band becomes thin. These are the abnormal electrophoretic pattern. Just by watching the electrophoretic pattern, the individual can be diagnosed against various diseases, like we can identify whether he is suffering from chronic infection or multiple myeloma or nephrotic syndrome or cirrhosis. Then benzosone proteins, these are the monoclonal immunoglobulins. The light chain is excreted in urine. It is seen in 20 to 30% of myeloma patients. Alpha 1 antitrypsin deficiency can also be seen. There are two disorders associated with the alpha 1 antitrypsin deficiency. They are emphysema and liver cirrhosis. These are the abnormal conditions of the plasma proteins which are involved, which we have seen. Let's sum up that blood is the fluid connective tissue. Blood is made of plasma and formed elements. Formed elements include RBC, WBC, and the platelets. And plasma is nothing but blood minus formed elements. These formed elements is nothing but the plasma. And serum is plasma minus fibrinogen is nothing but serum. These plasma proteins, what we are discussing is about the plasma proteins, albumin, globulin, and fibrinogen. We have seen the functions of albumin, globulin, and fibrinogen. Albumin globulin ratio, which is very, very important, is 1.2 to 1.5 albumin and 1 part of globulin. Albumin is a major part of the plasma proteins, maintains osmotic pressure, transport, and buffering capacity. It has buffering capacity and it is a complete nutritive protein. And gamma globulins, we have seen that there are presence of alpha globulin, beta globulin, and gamma globulin. Alpha is again divided into alpha 1 and alpha 2. Beta is again can be discriminated as beta 1 globulin and beta 2 globulin. Gamma globulins are nothing but the antibodies, immunoglobulins. The transport proteins like ferritin, ceruloplasmin, hemopexin, etc. are nothing but the globulins. Lipoproteins, they are also nothing but globulins. Then the last one is fibrinogen, which is involved in the blood coagulation. Hope it is very easy to understand. Follow this, and if you want to get a clear idea, watch it once again, and thanks for listening. Thank you.